All right, I'm on. Because John won't let me start it yet, so. He said 5:45, John, what the fuck? I don't know what he's doing. It's live on Facebook. Oop. Hello? Can you hear me? John?
I can hear you good, Doc.
Hey, Rick, how are you?
Good, how are you?
Oh, I'm doing all right.
Yeah. I bet you're frustrated.
A little bit. Are you able to join by video or no?
Not yet.
Okay.
I wasn't aware that video was blocked. Apologize. You guys able to join now?
Nope.
No.
I don't see anything here that's blocking video. We may need to close this meeting in order to enable the setting. I don't know. I've never had a meeting that didn't permit video before.
Hey, John, did you try on the bottom? I can't do it. I can't see it because I'm not the host. But on the bottom, if you're looking at the participants, there will be 3 little dots, and if you click
Yep.
on that, it should. You did try that?
Well, participants, and then yeah, like when I click on to a given participant, I see that video is blocked out for everybody.
No,
It doesn't even permit me to enable video.
it should be on the bottom, not per participant, because I have to do this for the CCRC meeting. If you look at the very bottom of that window, I can't see it because I'm not the host, but there will be 3 little dots for the settings. It's kind of hard to see. If you're able to make me a host for a second, I can do it.
Yeah.
If you want me to.
Yeah, no, by all means. Here, hold on. That's you, Alyssa?
Yeah,
There you go. Go to it.
got it. Okay. Yep, I figured out how to do it. Okay, you guys should be able to turn your video on. Let me switch it back.
Oh yeah, awesome.
Okay, so if you're looking on the panelist window, on the very bottom right side, there's 3 little dots. If you click that, it pulls up the settings.
Panelists, 3 little dots.
Very bottom of the white window.
Yep, got it. And allow panelists. Yeah, I don't. Yeah, my allow panelists. Oh, maybe you just check that. Yeah.
I clicked it on. Yeah, it's clicked on now.
Cool. Thank you.
Yeah, I have to do that every week for the CCRC meetings, but it took me a while to figure it out.
Interesting.
Yeah. For some reason, when the meetings are set up under Clear Creek County, that account, it's disabled.
Good to know. I can get in and change it.
I gotta turn my email off. It's just, when nothing positive comes through in like a 4-day period, it's like time to turn it off.
I like a new background.
Mine?
Mine.
Oh, yours? Yeah. Where are you? Hawaii?
I wish. I'm manifesting my destiny.
Hey, John, can we figure out how to put a COVID molecule behind me?
Undoubtedly.
I can make that happen for you.
All right, well, it's 6 o'clock, so let's go ahead and get started. Thank you, everyone. I'm Suzanne Boscia. I'm the County Emergency Management Director, and I've been with the county about 1.5 years. I've been working in emergency management more than 20 years, and I'm really happy to be here, and we have our work cut out for us here. So what we'll want to do tonight is we're going to go for an hour. We'll try to be as brief as possible in giving you an update on where we are nationally, statewide, and through the county as far as COVID status goes. We'll talk about that from our public health director. We also have Alyssa Dinberg on board with giving us a very brief update on our recovery efforts, even though we're still in response, where we're doing response and recovery simultaneously. Then we will talk about, we will open it up, for questions and answers. So if you are on the Zoom, go ahead and type something into the Q&A. If you're on Facebook Live, just put it in the comments and we will coordinate those questions. I'm going to do a very brief update on kind of what we're doing for response in the county, and then I'll turn it over to public health. So what we're doing right now in the county, we ramped our emergency operations center back up due to the significant increase in COVID cases. What the EOC does is we coordinate among the responders and decision makers for what we need to do. We do a lot of information sharing, public information, and then identifying resources like PPE that we might need, personal protective equipment like masks and gloves and gowns, make sure our first responders and our critical workers within the county have that they need. So the good news is we're in really good shape for the county for that. We worked real hard and during the early days of COVID, the early months of COVID, to get enough and what we needed. So we're in good shape there. Tim is going to talk about our change to orange level tomorrow morning and what that means. As far as my closing statement before I hand it over to public health, case numbers within Colorado are rising significantly. We've talked a lot within the county about our messaging and the urgency for people to take this seriously. I'll give you an example. I was supposed to go camping this weekend and we canceled. We just didn't have the confidence that we were going with a couple families, and we just didn't have the confidence that the kids would be able to stay away. And it was a really hard decision to make, but it was a temporary, not really a setback, but a temporary negative to have to break it to my kid and his friends, but it's for the greater good, and for hopefully that doing that will contribute even a little bit to keeping these case numbers down and our hospitalizations down throughout the metro area and the state. So now I will turn it over to Dr. Tim Ryan, our County Public Health Director. Tim.
Thanks, Suzanne. Good evening, everyone. Thanks again for joining us in our second, what is a monthly town hall, trying to provide the broader community with an update on COVID, both in our county, but also more broadly in the state and across the country. So having said that, I will start then a slide presentation that I put together. Everyone see that? So across the United States, what we're seeing is this. Over the last 8 months or so, obviously COVID has been in the United States. And on the far left here, in this chart, the United States is the green line here. Can you see my arrow? No. The green line here. And as you go through, you see in middle of the summer, we had a significant increase in cases as people became more mobile after lockdown and traveled around the country, et cetera, where we saw a significant increase in cases. Now, what we're seeing, yeah.
It's on presenter mode, so we can't really see the chart. If you go up to the display settings, you should be able to fix that because the viewers aren't going to be able to see that. I'm sorry to interrupt you. Go to display settings and you should be able to fix that.
Where is display setting?
At the very top. I'm sorry, I didn't mean to interrupt you. We can't see those numbers.
Oh, here. What should it be on?
Go back to presentation and the display settings is on that window. Go back to where you were. I'm really sorry, guys. I just want to make sure everybody can see this.
How's that?
We can't see anything right now. You have to share your window again.
Apologize for the technical difficulties.
There you go.
How's that?
There you go. Perfect.
Okay. So back to the chart, this green line on the far right, as you see, a significant increase in cases over the last 4 weeks across the United States. Through most of this pandemic, we've been hovering around, on average, around 40 to 50,000 new cases a day. Over the past week plus, we've exceeded that significantly. We're over 100 to 120,000, with 140,000 as a new record just the other day, and today 142,000. So almost doubling of the number of cases just in a 3-week period. Currently, there are roughly 43 states exhibiting significant increase in case counts throughout the country. This next slide shows this in a little bit more detail. So as you see here on this top graph, the far right, the precipitous increase here in new cases across the United States, crossing that 100,000 threshold on a daily basis about 3 to 4 weeks ago. The graph on the bottom shows new reported deaths by day in the United States. As you see here on the far left of this, we had a significant increase at the beginning of this as the pandemic began. It then subsided, and then we saw a little uptick in the middle of the summer here. What is most troubling is what we're seeing on the far right now. And although this is just the beginning of it, typically there's a several-week lag between the number of new cases and hospitalizations. On that lag, it's about 3 to 4 weeks. And then fatalities happen about 3 to 4 weeks after that increase in hospitalizations. So we're just now in beginning in the stages of increases in fatalities. We've now crossed once again 1,000 deaths per day here in the United States. And now we have exceeded 243,000 fatalities across the US in just 8 short months. So quite troubling. Here in Colorado, we're seeing a very similar pattern. As you see by this graph, here in Colorado over the last 3 weeks, as I've been saying, we have a significant increase straight up. This is what we call exponential growth. Really, absolutely nothing stopping it. We went from a little under 1,000 cases a day to now well over 3,000, and we passed 4,000 cases today here in Colorado. So literally in a matter of weeks, we've doubled our numbers as far as new cases are concerned. This next graph shows this in spades in terms of each week, the number of increase in number of cases per week. So here you see on the far right, the last 5 weeks or so, we've seen a 33% increase, followed by 29, and then 32, 49, and 41. And this is only through 2 weeks ago. So these next 2 bars that we're going to get here in the next day or two are going to be even higher than the previous bars. Quite troubling here in Colorado. And the percent positive trends in testing update as it relates to those numbers. Here on this graph is the 3-day moving average of percent positivity. And what that means is how many tests of those we test in a day are positive. Colorado has been hovering over the last several months around 4%, 3 to 4%, a little bit sometimes around 5%. As you see, we're now at 12%. So we've more than doubled the test positivity rate in just the last 3 to 4 weeks. This bar graph is just an indication of where we are in Colorado as it relates to all the other states in the union. Previously, we were about 6 or 8 bars further down the ranking than we are now. We've gone up to about 410 cases per 100,000 here in Colorado. So almost a doubling of where we were just a few weeks back. Again, very troubling. And as you see on this, a number of our neighbors are on this list in a worse situation than we're in. North Dakota, South Dakota, Nebraska, Wyoming, Montana, Kansas, and Utah, all in very much significant trouble, because what they're seeing now in those states, in all of those states, with the exception of maybe one, do not have a medical infrastructure to speak of. So Wyoming and North Dakota, South Dakota, Idaho, Montana, there aren't really medical facilities there. So when their case counts and hospitalizations get to the level they are, a lot of that overflow comes to neighboring states like Colorado and Utah. So our hospitals aren't just receiving patients from Colorado, they're receiving patients from all of our neighboring states. So currently in hospitalized patients and new hospital admissions, what we're seeing across the state is this very troubling and very telling slide. As I said, hospitalizations are on a several-week lag from new case rates. So what this slide is showing is the black line is what we're actually observing today. The green line was a projection made on November 2nd, based on a 62% transmission control. So our ability to control it was limited to 62%. And based on that model, the green line was the projected number of hospitalizations. And a prior projection was done on 10/26, so October 26th, with a 65% transmission control. So as you can see by this graph, our ability to control the transmission of this virus in the state of Colorado has gone down significantly. It was in the 70 to 80 range for many, many months. It was down at the end of October to 65%, is now down to 62% just 10 days ago. And what we're seeing is it's actually, this black line is suggesting that our transmission control is actually less than 62%. So we're doing a really poor job of controlling the virus within our state. This is showing hospital admissions by percent change by week. And as you see on the far right, all of these pink bars, all these pink bars are not a good sign at all. They're heading in the absolute wrong direction. And once hospitals are filled, then we will have a much bigger issue, because if hospitals are filled and individuals still need to go to those hospitals, that's when our fatality rate starts to uptick significantly. And given that we've already crossed 1,000 deaths per day just a few days ago, its current estimates are that our case rate is likely to double here in the next several weeks and months, and subsequently our hospitalizations, and then in turn our fatality rate. So not a very good story to tell, but unfortunate reality and where we are today. Looking at fatalities, as I said, a significant delay between cases and hospital admissions. You can ignore pretty much the very far tip of this graph, primarily because the data is not yet in. So as you can see, the trend is trending upward, and the current projections are to have this significantly higher than where it is now. The trend is going straight up. Here in Clear Creek County, to date, and these numbers have unfortunately changed since I wrote them on here. As of today, we had 14 new cases today alone here in Clear Creek County. So that case count there should be 134 with six hospitalizations. We've tested roughly 2,500 plus individuals in this county to date, and we'll continue to do so. We currently have testing. This week, we tested roughly 200 people already. On 3 different test dates, Tuesday, Wednesday, and Thursday of this week. Still one fatality here in the county. Our 2-week cumulative incident rate is now at 462 per 100,000. That likely will be going up by tomorrow when you take into consideration the 14 cases we have today alone. And our test positivity rate is now above 9%. It's 9.16%. Slightly lower than the state average, which is 12%, but about 9 times higher than it was just a few weeks ago. So in summary, cases are increasing exponentially. Exponentially is the only word that can completely describe what we're seeing. Exponentially in layman's terms, it's absolutely out of control. Transmission is out of control. Hospitalizations are out of control, and fatalities are shortly to follow. Hospitalizations and cases, as I've stated, have reached their highest point since the start of this pandemic. Contact tracing and outbreak investigation capacity in this state have been exceeded, meaning there are some counties now who don't even call half of the cases because they don't have contact tracers and the ability to do that. We're lucky here in Clear Creek County. We're now within the realm of being able to contact everybody, but that could suddenly change if we have a significant number more than we have now. But as of now, we're able to contact trace everybody and do the best we can with that. Basically, weekly updates from the model that's done by the Colorado School of Public Health is showing that the transmission control, our ability to control the virus through public health measures, is decreasing, and the reproductive number, the R naught, is increasing significantly. An R naught of 1 suggests that for every one individual who is a positive is going to infect one person. That R naught is now at 1.7 or 1.8. So a significant increase from just a few weeks ago. At current transmission levels, we're projected to exceed ICU capacity in sometime in late December or sooner if the R naught continues to increase. The reason I would caveat that and put a star by that is because what happens over Thanksgiving weekend can have a massive, absolutely massive impact on all of these models in a good way or in a bad way. So time will tell as far as how that plays out. So as the disease rate continues to increase, the strength and duration of our interventions needing to reverse the trend need to increase. So when it gets to be so bad, there's only really a couple things that we can do to help even begin to reverse the trend in what we're seeing. That's the end of the presentation. As far as our status in this county, as Suzanne alluded to, we are moving to level orange, or what used to be level 3. CDPHE moved us to that as of Monday. It'll be going into effect tomorrow morning at 6 a.m. That has the greatest impact probably on restaurants and stores, where the restaurant capacity is down to 25%. It's really primary aim is to help minimize and reduce the potential for transmission. And we do now know that probably half of the transmission in our county, half of it is from within a household, one spouse giving it to another and or their children, and the other way is through small gatherings. And those have now extended out to include restaurants where 2 friends get together or 2 siblings get together at a restaurant who don't live together, spend a good hour together, less than 6 feet apart, both without masks on, and the end result is COVID. So it's really the small gatherings that are driving our numbers. Just interacting with your neighbor or your friends or your family who come over and you're comfortable with them and you take your masks off, but that's really driving our numbers. Small social gatherings and people at work not wearing their masks while they're at work. One person gets infected and suddenly everybody at work is becoming infected. And this is not just within our county, it's individuals who work in other counties, who live in Clear Creek County, who come home to the county. So a number of variables driving what we're seeing. I will say for Thanksgiving, because that is the next holiday that is on the calendar, I would strongly, as strongly as I possibly can, encourage you to not have anyone in your home who does not live in your home for Thanksgiving. I know that sounds horrible and not what we want to do as far as celebrating Thanksgiving in America, but it's our unfortunate reality. When you invite other people into your home and you spend hours in your home without a mask because you're eating and drinking and socializing, it only opens the door to the potential for you to get infected. 3 weeks ago, it was 1 in 300 Coloradans was actively infected with coronavirus. 2 weeks ago, it was 1 in 200. A week ago, it was 1 in 100. You can follow the math. So probably right now, my current estimate is it's likely around 1 in every 50 people or 1 in 75 people is COVID positive. And we know that 40 to 60% of them are completely asymptomatic. So you can invite a friend or family member in your home and not know that they have COVID until the next day when they start feeling symptoms. And it's 10 days or so down the road, you're going to be COVID positive. So Do yourself, your family, your neighbors, and the entire community a favor. Stay home, enjoy your family at home. Do a Zoom meeting with your family if you want to celebrate and share Thanksgiving, but please avoid social gatherings of any size. It's driving our numbers through the roof. It's why we have 14 cases today, with probably dozens more coming in the next few days of the 200 that we tested over the last 3 days. So I'm pleading with you as the public health director, do your part. Don't have social gatherings, wear a mask, social distance when you're out in public, and do everything that you can to help stop this. If our numbers get so bad, it's quite possible that we will move to level red, at which point the county will be shut down. I don't want to get to that level. I'm sure everyone in the county doesn't want to get to that level. But if we get to that level, it really won't be up to us. CDPHE will likely call and say, it's time to shut everything down. We're not alone in this. Many counties around us are in the same boat. So unless we can all come together and work together as a community to save our community and save those individuals in our community, that's the only way that we're going to make a difference. One final thing I want to say before we start, Alyssa, is there is an app out there that was developed by Google and Apple. The intention of the app, and I'm sure you got a push on your phone, the intention of the app is to help identify when you have exposure, because 40 to 60% of people are asymptomatic, and you don't know the guy that you were standing in line next to at the grocery store or wherever. The way that it works is, as you move about, if you enable the app, as you move about, it sort of records exposure to other people. If an individual that you've been exposed to becomes positive and they go back on the app and hit the identify and let people know, it will let you know that you've been exposed to somebody in the last several days that has subsequently tested positive. It's very informative for you. It will also alert you to get tested, obviously. The current estimates are if 20% of Coloradans enable this app on their phone, it would reduce transmission by roughly 15%, which is enormous. If anything you can do to just download an app, it's free. It's not going to collect any of your information. It's completely anonymous. And it has the potential to have a huge impact from a public health perspective. I strongly encourage you to do that.
Thank you, Tim. Appreciate your frankness in telling the public how it is and what we're dealing with at the government level. I do want to emphasize, we're going to do what we can to continue to provide the information to you and be available to all of you to answer questions. But as Tim said, we really need your help to realize the seriousness of the situation that we're in and the potential impact it could have. As Tim mentioned, the impact potentially to the hospitals and the ability to provide effective care, whether you have COVID or whether you have something else. If the hospitals continue to fill up, the state's working on a number of things that could help that, but we can do our part. So thank you for that. I'm going to hand it over for a few minutes now to Alyssa Dinberg. Alyssa is our recovery coordinator. She's going to talk a little bit about our our business grants and our individual grants. Alyssa.
Thanks, Suzanne. All right, so I have a couple updates for everybody. In our last town hall, I talked about our Clear Creek Cares About Business grant. This program was set up with the dollars that we received from the federal government through the CARES Act. And we were granting out anywhere from $5,000 to $20,000 grants.
Alyssa, it's a little bit hard to hear you. Can you get closer to the mic or adjust them a little?
Is that better?
Little.
It's my headphones. I'm sorry.
Okay. We can hear you. It just sounds a little far away. Go ahead.
Okay. I apologize. Let me move my hair back. Grants were anywhere from $5,000 to $20,000. The program is now closed, so I just wanted to give everybody an update on it. So we had 73 businesses that applied, which totaled $1,238,020 in requests. That was significantly more money than we were awarded through CARES and that we had budgeted for this program. And so it identified that there was a significant need in the community. To date, we have awarded $499,768 and that is going to 49 businesses in the community. We know that some businesses were not awarded, and know that some businesses did not apply at the time that it was open. Because of this, we have applied for additional funding. We should hear any day. I did hear from our state rep today that we should hear hopefully tomorrow or Monday whether we receive this additional funding. If we did receive this additional funding, we will be doing another round of grants. So the people that did not get the full amount could potentially get their full amount. And then those that did not apply or did not receive anything could potentially apply again. So be on the lookout for that. If we do get the additional funds, we will be sure to post it on the website, on social media, and send emails out to the businesses. The next program that we have, we just launched a week and a half ago, and it is our individual support grant. This grant, we have $50,000 that we're going to be giving away to individuals in the community that have been impacted by COVID. So this grant can pay for utilities, transportation costs for essential type trips, pre-K, childcare, mental health support. If you're facing eviction charges, we know there's an eviction hold at the moment, but we know that there are potentially fees associated to that eviction, so this grant will pay for that. And I believe that is it. I always feel like I'm missing one. So that grant is currently live. I have been getting a lot of questions on how much money we have left on this. We have received 15 applications to date. As of right now, those applications are still being reviewed, and so we have not officially cut any checks, but those checks should be cut fairly soon. So those are my two updates right now. We do have a couple other things for the businesses that we're trying to help out with, such as the Business Survival Toolkit. You will be getting, businesses in the community will be receiving this hopefully starting next week. And the goal with this program is just to help mitigate some of those additional costs that you're having to face due to COVID. So you'll get a box of masks, a gallon of hand sanitizer from Tommy Knockers. We're very happy to be able to keep that money in the community. A thermometer if you need it, and then resources on ways to keep not only your staff, but the community safe. And so information on how to track temperatures, information on what symptoms to look for, and proper cleaning techniques. So businesses will be receiving that soon.
Okay, thank you, Alyssa. Appreciate that. We're going to jump right over into questions. There's quite a few, so we can go ahead and get started. We are coordinating questions that you all type into the chat here in Zoom as well as via Facebook Live, so feel free to keep sending those in. Tim, surprise, first few questions are for you, or maybe all. Let's talk about the color dial. Someone had asked a question about, I think it was your second to last slide, and the question was, you say that we're in orange, it looks like we're in red. Can you talk a little bit about that, how that's working at the state level and what the colors are showing?
Absolutely. So the colors, and they were previously numbers. It was stay at home, safer at home 1, 2, and 3. And then the state switched to colors, blue, yellow, and orange. They don't really represent anything other than the colors they chose. Each of those colors and or numbers associated with a 2-week incident and test positivity rate that were determined by the state months ago in terms of thresholds of how open could your community be if you had X amount of cases and X amount of test positivity in a given time frame, in this case 2 weeks. As counties went along and opened up and began to open their economies back up, those metrics were used to then determine where a county would be in terms of how open they could open up their businesses. So we were at level blue or level 1 for a very long time, up till about 3 weeks ago when our case counts started to go up. The state, what they do is if you get to a level in terms of your numbers, they give you 2-week period to bring your numbers back down. You obviously can't change things overnight, so they give you a 2-week window. At that point, I was in discussions with CDPHE and the state. They gave us 3 weeks to get our numbers sort of in line, and the numbers did not obviously go back down. They actually went up. At which point the state, last Friday, we had a conversation with the state as well as the Board of Health and others on the call. At which point the state informed us that we'd be moving on Monday, this last Monday, to yellow, and then subsequently on Wednesday to orange if we didn't, if our numbers didn't change, and they obviously didn't. So I reached out to the state and asked if we could forego the yellow declaration and just go straight to orange on Friday as opposed to Wednesday. Our numbers have subsequently gotten worse. So tomorrow we are going into level orange. We will remain in that, even though our current 2-week or 2-week cumulative incident rate is now red, and our test positivity rate is close to 10%, also putting us potentially in the red. We would not go to red for several weeks at a minimum, for reasons I just explained. The state is giving us several weeks to get things under control. If we do happen to get them under control, we will move in the opposite direction. So back to yellow and then subsequently to blue if we can achieve that. But again, it's going to take the entire community to help us do that.
Okay, thank you. Let's take a question that is similar to the levels, in that it talks about the figures and the rates need to be compared to like figures for seasonal flu, of which shutdown measures are not taken. Most specifically, hospitalization and death rates. It says incidence rates are irrelevant as many are asymptomatic. You know, we've heard some of these comments before. Tim, I'd like you to address that.
This isn't the flu. It's far more deadly than the flu. Obviously, we have almost 250,000 dead Americans in less than 8 months. The flu doesn't even kill that many worldwide on any given year. So I don't think comparing flu to COVID it's an apples to orange comparison. It is not apples to apples. So yes, 40 to 60% of people are either asymptomatic, mildly symptomatic, or moderately symptomatic and do not either need hospitalization or die. There are far too many that do. And so we're taking this far more serious than flu because, one, it's far more easily transmitted than the flu, as we see now in spades. This many Americans do not get the flu in any given year that currently have it. We've exceeded 10 million COVID cases in the United States alone. We are, and I can go back to the graph if you'd like, we are hands above the rest of the world in number of cases, number of hospitalizations, and number of fatalities here in America. We are unique in that unfortunate situation. So it isn't the flu, it's far more deadly than the flu, as the numbers would indicate, and that's why we're taking it far more seriously. In addition, we do not currently have a vaccine. We have a vaccine for flu every year, which helps prevent the hospitalizations and fatalities and case numbers that we're seeing. We also do not have herd immunity. The vast majority, 85+% of Americans, do not have any prior exposure to SARS-CoV-2, COVID-19. So given that most Americans don't have any sort of antibody response in their system and we don't have a vaccine, this is why we're taking it far more serious than the flu.
Thank you, Tim. We did get a response in that. There's still some a little bit of criticism that, you know, the flu does kill a lot of people and COVID kills as well, but the target is at risk and elderly. I think that we've explained this, and yes, people do die from the flu. Dr. Ryan is not discounting that at all. But right now, for example, if you listen to some of anecdotal stories, and that's not that's just one-offs here and there, but if you listen to stories, there are folks that are young and very healthy that are going into the hospital and needing ventilators. There are folks that are in the at-risk population that aren't getting as severe symptoms. You don't exactly know how it's going to affect any one person, and being young and healthy with no real health conditions doesn't necessarily mean you won't need hospital care. That's a little bit different than the flu. We know about the flu. We've been dealing with the flu for a long time. This is new. So encourage you to continue to offer some thoughts on this if you'd like, but we're going to move on to another question related to schools. So Tim, I'm going to ask you this question as well. I know you've been coordinating a lot with our schools. What do we do about our schools where we are gathering on a daily basis with parents now starting to get sick?
So what's going on in the schools? So far to date, we have seen no transmission within the school, meaning from one student to the other inside the school. All of the transmission that we have seen within students has been gotten outside of the school, meaning those students hang out with other students after school with their parents' blessing without a mask, and or they're in a car, carpooling together, 3-4 of them, and they not wearing masks and they get COVID there. I've been working since day one with the school superintendent and the principals of the schools. And I think the protocol that the schools have put in place and reinforce on a daily basis is sufficient to keep our children safe in the school. Now, what happens outside of the school cannot control. If parents will allow their children to socialize with other children, therein lies the problem in what we're seeing. We're going to be implementing starting this Monday at the middle school and high school. We'll be testing all of the teachers and staff twice a week and trying to identify early individuals who may be sick. Although to date, no teacher has brought COVID into the schools. So we're doing that as a sort of a precautionary measure to just try to identify any potential coming in through that route. I think with the children and the protocol that's at the school and reinforced at the school, will provide a good sense of protection within the school. I'm also hoping that the further restrictions more broadly in the community will help at least create a little bit more of a bubble for what goes on in the school and controlling what goes on outside of the school to help keep the kids safe beyond that.
Okay, thank you. There is a question about how often or if people are getting COVID more than once. Do you have any data on that?
Right now, that data is anecdotal. This pandemic, as everyone is well aware, has only been going on for about 8 months now, 7 really in full force. And so the duration so far hasn't really been long enough, but we do know factually that you can get COVID again. It really has to do with your antibody response. Like most viruses like this, your body will react uniquely to it. And so what the amount of antibodies that you have built up in your system and how long those last. For some, it lasts a few months. For others, it lasts many months. We're still in the process of collecting that sort of data from a statewide and nationally to better get a handle of that. But one fact you should know, you can get COVID again. Just because you've had COVID, it does not give you a free pass. It doesn't make you immune for life or any sorts of those fantastical ideas. Those are not based on reality. The fact is you can get it again. When that happens, we don't really know.
Thank you, Tim. The next question, we're going to shift just a little bit to Alyssa related to grants, and then we're going to go over and talk a little bit about Thanksgiving. So Alyssa, we had a question coming in for you about whether there'll be any grant money for small businesses that do not have at least one W-2 employee. Can you talk about that?
Yeah, so for anyone that applied for our first round of grant money, they know that one of the requirements is that you had to have at least one W-2. And the short answer to that is I don't know. A lot is dependent on whether we receive the second round of funding. We asked for about, I know the exact number, we just looked it up today. We asked for $724,000 for businesses. So that is significantly more than we granted in the first round. The group that determined the eligibility in the first round is going to have a meeting next week to go over all of the eligibility requirements from the first round and determine what they're going to change for the second round, assuming that we get the money. We feel fairly confident that we're going to get the money. We've heard through the grapevine through several different sources that we feel like we are going to get it. And so with the second round, we do hope to be able to open it up to some additional businesses that weren't eligible in the first round. Unfortunately, that's not a concrete answer, but more to come.
No, but thank you. I know you've been working hard with lots of other folks in the county to try to get as many grants, different grants and funds that we can get to support our community, because we know the impact is pretty severe here. So let's move over to a question for Tim related to Thanksgiving, and this is it's a comment question. That some people are going to do Thanksgiving Day gatherings anyway, with kids coming home from college, military leave, etc. Do we have any recommendations, or are there any recommendations out there for how to do this most safely? The follow on was, what about getting tested and then self-quarantine until Thanksgiving Day? Tim, can you talk about that?
Sure. My first recommendation is to not get together, first and foremost. If for some reason you feel inclined to do that, then have it outside is one way, if the weather is conducive to that sort of thing. We know here in Colorado that can change on a dime. So having it outside is a good alternative. If you have to have it inside, I don't really have advice for you. Obviously, you're not going to wear a mask the whole time. You're going to be in your home, which is a small, from a volume, a fairly small area, particularly if you're in there with several people over several hours. If one person walks in your home who's COVID positive and shedding, I guarantee you will get it, and everyone in your home will get it. I don't know how to put it any simpler than that. That's just reality. Having things on Zoom is another way to address it. I understand, and I don't make this recommendation lightly, but when you invite people into your home, right now it's safe to assume that anybody you look at is probably COVID positive, is a safe way to sort of look at things, particularly people who have traveled home, students, military, etc. The fact that they've traveled through airports and through airplanes and other modes of transportation, buses and trains at the airports, only increases the potential for them to get COVID. And this sort of thing is gnawing on in my back of my brain. So I'm going to say it one last time just to make things abundantly clear. Right now, with the numbers of 140,000 plus cases a day, those numbers could double or triple within weeks. If those numbers double or triple within weeks, hospitalizations will double or triple within weeks. And if those double or triple within weeks, deaths will soon follow. And if you double or triple deaths currently at about 1,200 to 1,400 a day, you're now looking at 3,000 to 4,000 fatalities a day. So it ain't the flu. It's not going to be like the flu. So don't act like it's the flu, because it's not. They're not even in the same ballpark at all.
There's a follow-on to that about that for folks that will be getting together. For example, again, folks that are military or folks coming home from colleges and universities. What about that? And I think you talked a lot about that relation to, yeah, it's cold here, but maybe having it outside. We're actually considering that. Even though it could snow, you never know what's going to happen. Considering doing it outside, we're going to probably do a Zoom Thanksgiving, and we're choosing, unfortunately, not to get together with relatives. It's a very difficult decision. I want my son to be able to play with his cousins, but it's just not going to happen this year. In part, we look at a lot of factors in making any decisions for the county, but in relation to our emergency response and our recovery. And again, our factors are case numbers. That's one, but it has a lot of impact on our first responders, because they are out in the community as well. If our first responder organizations start to feel that impact significantly, if staff needs to quarantine at home, that's something we're going to have to deal with as a small county, and we can't rely as much on our partner counties as we would in for example, in the large wildfires that we had and that are still going on, although much less so. But that's a different kind of response that people are able to get. and provide, because they can reserve some response equipment and personnel for their own county and offer up what they can. In this case, it's really, really difficult to know what's going to happen day to day at this point. If anyone was following our public updates kind of from March on this, it's similar to back at that point, in that there's a lot happening every day. So there's one question here about, is Denver going to shut down? I don't have any information on that. I don't have any solid data. I talk with my partners that are in Denver. I used to work for Denver Public Health and Environment, so I still talk with my colleagues there. They're looking at all the numbers and the impact to their city and county as well. It's really hard to say, but suffice it to say, you've got a lot of people working around the clock all weekend and have been pretty much since March to try to make the best decisions that we can with the limited information and the current information we have at the time. That's the best that we can do. And that's one of the reasons that we want to be able to offer this town hall to all of you, to be able to ask those questions directly and talk directly with the folks in your community that are doing their best to help. So that was the question there. Thank you for that. Let me see if we have any on Facebook Live right now. Okay. One question, we talked a bit about the orange level, and that goes into effect, in Clear Creek tomorrow morning at 6 a.m. And the discussions that we had with the state recently talked about the need to, give businesses in the whole community enough time to be able to prepare for that. There are impacts, beyond businesses that are being taken seriously about, for example, rec centers and workout facilities that have to be reduce their percentage. The county is reducing its workforce that are coming into the office. They are really encouraging people to make appointments and only come in via appointments, do as much as possible online. And the reason is because we need to reduce the amount of people that are physically in the office. We have been doing this for months within the courthouse office, but based on these numbers and all these factors, we are following the guidance and working out what that means for the county. We're continuing to provide the critical government services. Those are not stopping. Your first responders are out there, your public health folks are out there, and that's going to continue, but please help us to make sure that that can continue. We have a couple more questions that have come in. Good questions. 2 questions about how the change to the orange level impacts short-term rentals, bed and breakfast, VRBO, and also how does it affect our ski areas? And I know Tim has been working closely with our ski areas. So Tim, if you can touch on both of those, we can go there. Thanks.
Sure. First, with the VRBOs, the VRBOs have limited impact. The only place right now it's impacting, if you have a VRBO that is merely a room in your home that you're renting out and sharing, you have common shared space, we're going to have to put a halt to those right now. If you have a property that you're renting the whole thing to individuals, that's a very different thing. It's basically a hotel room. Without you're not sharing that space with anybody. So those are sort of the two categories that I see those in. One has the potential for community spread. Obviously, you're sharing space with strangers you don't know who came from wherever they came from. The potential is significantly increased. The flip side of that is you're renting your entire home. You're not there. The people who rented it are the only ones there. And that's sort of how I see it. If it gets to red, all of those will stop as they have in the past. As far as the ski resorts are concerned, Loveland Ski Resort, I'm sure everyone heard, opened yesterday. Whoop, whoop. I have worked with both Echo Mountain and Loveland on their operational plans. Loveland's obviously was approved. Echo Park is still waiting from the state approval. They have a significant operational plan in place with that I've reviewed, and we've been there and toured the place several times to make sure that the risk is absolutely minimal. The one thing that those sorts of things have going for them is their outside activities, their individual activities. You're not huddled with tons and tons of people, for the most part outside. Inside the facilities, the restaurant and bar, et cetera, are abiding by the exact same rules that every other restaurant in Clear Creek County is abiding by. 25% occupancy, lots of different protocol within the facility to help mitigate and minimize and reduce the potential for spread.
Thanks. Kind of as a follow-on to a ski question, but not limited to ski areas. They're asking for advice that you have for people who work with the public, and they said such as at Loveland. I feel like we've talked about this quite a bit. It's essentially the similar message as we've been saying for many months about masking and hand washing and keeping distance. But I think that is a really good question that, Tim, I'd like to ask you to weigh in on. For people that are working with the public, is there anything else we can offer them as far as recommendations?
No, I mean, if you're interfacing with the general public on a day-to-day basis for your job, there's some very basic things that you need to keep in mind and do without fail. Wear your mask. Wear a proper mask, one that is clean, one that you cannot see through, not a gaiter. A gaiter is effective, but of the least effective of any mask you'd possibly wear. So a non-gaiter. Distance from that person. You don't have to be next to them. Be as far away from them as you can, while still maintaining your role in the business in that you're doing with that individual. The other thing is you have every right to demand that they follow those protocol themselves as well. Whether you're the proprietor of a business or you work there, asking somebody and demanding that they put a mask on before you will interact with them is well within your right. And also move away from them if they continue to get closer and closer. It's your safety and your well-being. So do everything in your power to keep your distance and to wear your mask, and ask that they do the same. And wash your hands frequently. The more things you touch in your job that are community or communal property there that others can touch, all the more reason you need to wash and or sanitize your hands frequently.
Okay, thank you. Chris, are you on? There is a question that Chris Kraus, our Public Information Officer for COVID for the county right now, is going to address. Okay.
I don't see Chris.
Well, yeah, I don't see Chris. So what she wanted to emphasize is there is a phone number that anyone in Clear Creek can call to get an appointment. That number, I will say it, I can also put it up in the chat, and we can put it up in Facebook, is 303-670-7528. That line is a recorded line, so please leave a message, and someone from our public health department will get back to you. We have been getting some comments about we don't get an immediate call back. I would emphasize that with the amount of folks that are calling to get appointments, you are getting calls back. Please be patient. Again, I would encourage, if this is calling something related to, I have symptoms and I'm not sure what to do, please call your healthcare provider. Don't just wait for a response back. I'm sure that folks are not necessarily doing that, but our public health folks are doing incredible work and working very long hours, so please be patient with that. They're going to continue to offer testing at least twice a week, if not more. And I actually went this morning and got the new cheek swab test. It is seconds, it's 20 seconds maybe. It is so fast. The folks were great with our EMS department and our public health department. So thank you everyone for doing that. Yes, Tim.
I would just like to add to that. As I stated earlier, our nurses have conducted roughly 200 tests in the last 3 days. For a county of our size, those numbers are impressive. The system that we currently have, as Suzanne alluded to, we're testing 2 to 3 times a week, community testing. That does not include the testing they're doing at the jail and the testing we're doing at the school. So you can't expect to call in and get tested the next day. We're taking basically reservations the day before we're testing. So the expectation that somehow we can take 100, I mean, we're literally testing 60 to 70 people a day. And those are the 60 to 70 people who called the prior day and left a message that we've gotten back to and scheduled them. So that's sort of how the system works. We have limitations. We can't test thousands a week in a county of 9,000. It's just not practical. Our 3 nurses are doing the very best that they can do. And I think testing 200 in less than 3 days is impressive by any standard. In addition, if you are symptomatic, getting a test tomorrow isn't really going to change anything for you. Stay home. We'll call you back. We will schedule a test. And whether you get it on Tuesday or Wednesday isn't going to really change your life. The most important thing is going to change your life is you stay home and isolate away from other people, including your family. If you're feeling ill, don't go to work. We don't need heroes. You're a hero, in my opinion, if you stay home and do your job either from home or call in sick, because we do have many cases now in the county where individuals have gone to work when they weren't feeling well and subsequently went home later that afternoon, but unfortunately exposed many of their coworkers. And so now we have several people at one business that could have been avoided if that individual who is symptomatic had actually stayed home. I would do the same. I've asked my staff to do the same. I have to keep my nurses safe. If those three become COVID and positive and have to isolate, we're in a world of hurt in this county. So I'm doing everything I can to keep them protected, to keep our EMS protected, our police, our fire, all those people that are critical to life in our community. Keeping them protected is going to take everyone's effort, and we're doing the best that we can.
Thank you, Tim. I do want to, we'll have one more question after this, and then we'll wrap up. I do want to emphasize we are continuing testing. However, we will not have any testing the week of Thanksgiving. So please look at our county website in order to look at the latest dates and times for testing and call the number to schedule a test. And so the last question is still related to the orange level, and how will the orange level allow for any open gym type practices for the middle school or high school if it's a small group and masks are worn?
I would have to say no. Getting together any group that isn't normally together on a day-to-day basis in a situation like that is only asking for COVID. The gyms, the rec center here in Idaho Springs, as an example, can no longer have any group activities in their facilities. The facilities are still open, but no longer able to do group activities inside.
Okay, thank you.
Same would be true at the schools.
Yeah, I did get one other question about the name of the notification app for the public that the state is using. And I did post the link to it, but the name is the Colorado Exposure Notification. It's on your phone. It has to be activated. You essentially have to agree to it. Yes, Alyssa?
So Apple is already on your phone. You don't have to install anything. You just have to go to the settings and activate it. For Androids, I do believe you have to download something.
Yeah, and thanks. And I had put the link in the Zoom chat, and we can put it up on our Facebook if Chris is not already on there. Go to CDPHE's website, the State Department of Colorado Department of Public Health and Environment. They have videos and instructions on whatever type of phone or device you have, how to download the app and how to how to approve it for use. So That is the last question that has come up on chat. So thank you everyone very much for participating in this tonight. We will continue to do these monthly. The next one is December 10th. It will also be a Thursday night at 6 p.m. Information is up on our website. We are working to reorganize that a little bit. So again, be patient with us with that. It takes a lot of staff time to do that. So we're getting up as much information as possible for you and providing what we can to help you make the best informed decisions. So I thank you all very much. Thank you everyone on Facebook Live that participated. Thank you, Dr. Ryan. Thank you, Alyssa. And thank you, Chris Kraus, our Public Information Officer, as well as John Bottomley, our IT Director, for making this all happen. Appreciate it. And we will speak with you next month. We also do these COVID updates on the Board of County Commissioners meetings at 11 a.m. every Tuesday. So join us for that as well. Thank you.
Thank you. Bye, everyone. Wear your mask, please.